Hi, my name is Maggie Jalowski, and I'm the Director of Advocacy at Sickles. Today, I'll be talking about our Medicaid coverage landscape review, which is describing access barriers for sickle cell treatments. Sickles is a national advocacy organization. You'll be hearing from other team members today on several panels, and it's an honor to be here today at the SCDAA convention and sharing the work that we do. So some background for this project is that this effort was looking to address and really understand what are the barriers to accessing current and pipeline therapies for sickle cell disease. This was from the recommendation from the 2020 NASEM report. Currently, a national sickle cell surveillance system does not exist, which really highlights the need for landscape reviews to better understand what access looks like. How are they covered, what reimbursement looks like, and what are some of the expected outcomes from new treatments. Without baseline data or a national surveillance system, conversations can be difficult, so it's really important to fully understand the barriers as we work to improve our advocacy. It's also important to understand the role that Medicaid plays, as Medicaid is a key source of insurance coverage for individuals with sickle cell. So for this work, we focused on Medicaid programs across the country and worked to understand what access looks like for those individuals living with sickle cell within Medicaid. This project was launched in April 2022. So we partnered with Avalier Health, which is a research firm, to do this landscape review. And part of this included a survey of decision makers at state Medicaid programs. Additionally, the survey findings were supplemented by an environmental scan. And we'll talk a little bit more about what the environmental scan shows. This report is live on the Sickles website, so you can read more about the methodology and findings. Today, I'll be providing a brief overview of them, but overall, the report demonstrates where there are challenges today across Medicaid programs and how the programs may be improved in order to better facilitate access for those living with sickle cell. This effort was supported by contributions from the following companies. We thank our sponsors for this work. So the first task was the environmental scan data. In this, we analyzed preferred drug lists, prior authorization criteria summaries, and other coverage documents to understand what access looked like across 5 sickle cell treatments. These 5 treatments were Adakveo, Droxia, Indari, Oxbrita, and Cyclos. The chart on the left indicates more information about each of these 5 products. Please note that these are all 5 brand products. For this study, we did not consider generics such as hydroxyurea, as it was our assumption that access is better for generic products. So we really focused on brand therapies, as we recognize that those are the ones with more limited access, so we can get a better understanding of the existing barriers. And then across this review, we talk about the 5 different categories for access. They are located on the chart on the right, and those are unlisted or not listed, meaning products are not listed on the state's PDL. Step therapy and prior authorization. Step therapy is requiring to try and fail one or more other treatments before accessing the product. Prior authorization means the need to receive prior approval before accessing the product. And then at the end of the arrow there, we have open or unrestricted access. That means that the plan does not require either prior authorization or step therapy. More information about these definitions in our methodology can be found in our report. And then the second part, the task 2 of this project, was to survey Medicaid decision makers. And we went about this in 2 ways. There were 2 different surveys, one that Sickles conducted outreach for, and this was sent to Medicaid directors around the country. Another survey was also distributed through a research firm, and many individuals at managed care organizations or individuals with prior Medicaid experience completed these. The map on the left looks at representation of respondents by state. And then the states listed on the right were the 15 states that had responded directly from Sick Cells Outreach. So those are the Medicaid program directors or delegates that responded to the survey. Throughout the finding sections of our report, you can read more about 5 different areas or key finding topics. And this is the prevalence of utilization management, the way that contractors or other stakeholders are engaged in Medicaid, the many different factors influencing decision-making across the Medicaid program, the role of MCOs or managed care organizations, and then the movement to create health equity initiatives across Medicaid. For today, we'll look at one of the key findings related to utilization management. So our report found that at least 50% of the time, individuals with sickle cell will face access barriers when accessing Adakveo, Indari, Oxbryta, and Cyclos. Droxia had the least utilization management of the 5 sickle cell therapies studied. However, it still did have some restricted access. Again, the report will detail each of these therapies and with more information about what utilization programs were used. Additionally, we wanted to show here what the prevalence between prior authorization and step therapy are. And so you'll see that for each therapy, there is, it breaks it down to see how often prior authorization is used, how often step therapy is used, how often the combination of both of these are used, or how often it's unrestricted access to the therapy. And so again, I encourage you to explore the report and learn more about the difference between prior authorization and step therapy. Also, what we're finding across the states is that the use of utilization management varies significantly across state plans. 20% of the survey respondents indicated requiring prior authorization monthly for at least one sickle cell treatment. However, we found that prior authorization can also be required every 3 months, every 6 months, or every 12 months, which indicates a discrepancy or inconsistency across these programs. Additionally, about 20% of the Medicaid plans mandated step therapy for Oxbryta, Indari, Adakveo, or Cyclos. Sometimes some of these programs required multiple steps in order to then access the treatment that the individual was looking for. Another finding is that the states in the top half of the sickle cell prevalence list had facilitated more often open access than states with lower sickle cell prevalence. Specifically, Indari and Oxbryta are an example of this. We also found that oftentimes patients and patient groups were the least consulted stakeholders in decision-making across Medicaid programs. We found that preferences of patients and statements from patient advocacy groups were often not considered. More information about our work and our advocacy in Medicaid can also be read in our white paper, focusing on centering the patient voice in coverage decisions. And so finally, we'll offer some conclusions and recommendations. There's opportunities for the sickle cell community to come together and advance health equity, specifically with providing some bias and discrimination trainings across Medicaid committees. Secondly, there's the need to develop consistent prior authorization criteria and step therapy guidance to really have a common understanding of how they should be used to avoid treatment delays. There's a need for data to really understand data that adequately accounts for the patient perspective and can be used by these programs in their decision-making. And then finally, there's a need to improve more patient-centric decision-making with opportunities to engage publics with Medicaid decision-makers. Thank you for this time. Please, I look forward to answering any questions that you have. Please submit them in the chat question. Thank you.